Yeah, and Jay Coleman again. Yep, we knew COVID would mutate if enough people got it. And here we are. Here we are. I actually had somebody reach out to me on Instagram. Let me see. Let me see if I can find the screen grabs. So I had somebody reach out to me on Instagram recently. I had posted about how piss poor the how awful really the Trump administration's response was to the pandemic. And the guy, this person, he replied to me. He said, "Well, what would you have done any different? What could have possibly been done different?" Now, first of all, you could look at all these other countries that have done different things, and their per capita rate is death rate. Deaths per 100,000 are less than ours. Their infection rate is less than ours. We lead the world in deaths from this virus, and so you could look at all of that. But he wanted to know, what would you have done differently? What could have possibly been done differently? And so I commented back at him, and my comment was so long and so so much to it, it broke Instagram. It wouldn't post, so I had to screen grab it just to have it at all. But let me share this with you, because if you want to understand, because this is an argument you will get, and if you like me, have a weird obsession, if you're a person who picks at their own scabs or something, or you're a little bit of a you you torture yourself, you, like me, might like to get in conversations / arguments with conservatives and talk to them about politics and different things. So this guy, I feel that this is just this seems like a short list to me. It's only 10 things that could have been done differently around the COVID-19 pandemic. And this you can take this, use it in your arguments if you want. So here's what I said. Step 1, fully fund the Center for Disease Control. Trump defunded it. Pretty simple. Yes, he in fact did. Step 2, maintain the pandemic response team on the National Security Council. Trump dismantled it. So I'm starting simple, then we're gonna build, get a little more. But these are all things that happened before the pandemic. Okay, we had a fully funded CDC. We had like a team of 40 plus epidemiologists in Wuhan, China, or in Beijing rather, that kept their eyes on Wuhan and other areas where these novel viruses crop up. Trump whittled that team down to 12, or at least, if he didn't personally, the very great people that he installed at the CDC, they're the ones who did. Step 3, listen to the CDC and Health and Human Service advisors and their recommendations. Trump ignored them through January and February. That's the other thing. I'm not wild about Joe Biden being president, but we're going to have a president who reads the daily briefing, doesn't sit there watching Fox and Friends, and listens to his advisors, right? So, progress of a kind, I guess. Step 4. Once the crisis was upon us, let health experts and government doctors lead the public information campaign, not politicians. Trump wanted the spotlight at the briefings. Remember when he said it would just go away, or suggested injecting bleach? So there's actually a pandemic response playbook that the CDC has. And they even have this conference that meets every few years that's specifically about pandemic prevention and management, and they have this playbook. And one of the things in the playbook is don't let politicians be the forward-facing public information arm during a campaign like that, or during a pandemic. That is wrong. People don't trust politicians, but they will trust medical experts. I could add it into this list. Don't constantly undercut the one medical expert you do have, Anthony Fauci. And constantly attack him for nonsense. Step 5, have a clear and concise message about best practices to stop the spread. Trump politicized mask wearing, flagrantly refusing to do so to the point that he got infected. Also admitted to downplaying the seriousness of the virus. Yeah, we were just talking about this a minute ago. Politicizing mask wearing, turning it into a cultural signifier. Making it just another, oh, you want me to wear my mask, snowflake? Making it just another one of those stupid idiot things. Surely had an effect. Step 6, have a widespread and systemic federal response, including the Defense Authorization Act for PPE. Trump left states to fend for themselves. Some couldn't acquire the necessary equipment for medical staff, many of whom have died from the virus after caring for those infected. Yes, we have medical staff dying around the country. This is dystopian. This is dystopian movie stuff, people. We're living in this is the right-wing neoliberal libertarian dystopia that many warned was coming, after just a few years of Reaganism and the continuation of it by Republicans and Democrats, to be frank. Step 7, send face masks free to every American. I'm going to say it again. Send face masks free to every American. Does this sound like some kind of crazy Bernie Sanders policy? We're going to send face masks to everybody. No. The U.S. Postal Service was ready and prepared to do just that, and the Trump administration killed the plan. Step 8, pay people to stay home. The U.S. only ever had a partial lockdown, unlike other countries like Germany or New Zealand, which have a tiny per capita death rate compared to ours. New Zealand is virus-free. They literally have no COVID patients, no infections. It helps they're an island, of course, but hey, there you go, social democracy, funding healthcare, funding disaster response, and all the other things that they do there. Step 9, and this is kind of a big deal. Foster a sense of community and togetherness in fighting against the virus. Beyond hardly being able to admit there was a problem, Trump would constantly attack majority Democratic states, even saying he didn't want to send aid to the states like California or New York. These states actually contribute most in federal taxes. He also called the virus a Democrat hoax, right? So Trump would constantly do this. Why do we have to send money to Democrat states when they're so poorly managed? This virus hit the population centers early and quickly. Yes, there were mistakes made. Yes, Cuomo, sent COVID patients to rest homes. That was a really bad idea. Newsom has made his mistakes as well. Sitting in a restaurant without a mask wasn't a good idea. But this is also why I think even Newsom could stand to listen to the advice of let the scientists be the forward-facing public information part of this, not politicians. People love to hate Gavin Newsom out here, at least some people. Step 10, insist on passing Medicare for all, granting health care to all Americans as a human right at a time we all need it most. At this time, Trump was actively trying to destroy the Affordable Care Act through the courts during the pandemic. So I support Medicare for all. I got in a big hubbub with Jimmy Dore fans because I disagreed with the tactics of force the vote. We don't have to relitigate that. Maybe we will later. But, the Medicare for all would help. Even then, in a pandemic, Medicare for all would take years to unpack and happen. We could have something like emergency Medicaid for uninsured Americans would have been great. So none of these suggestions even takes into account what's in my post here, that there were Trump officials who thought the best way to handle this virus was to infect Americans. This is the herd immunity guy at HHS. So maybe probably also not that. But this is what I would have done. I'm no genius, just a guy who follows the news and has listened to epidemiologists talk about this. Hope that helps. So that was my thoughts on how could we have made the coronavirus pandemic not so bad, not like hundreds of thousands of dead in a year. COVID-19 is now the number one cause of death in the United States. It's past heart disease, which brings me little comfort. I hope that's not the way I go, but it is statistically most likely for me. Car wrecks. We've had less gun violence because everyone's staying at home this year. But it even surpassed that thing. Jay Coleman, herd immunity is a myth. Absolutely. Herd immunity only exists when you have a vaccine. When 60% or more of a population is vaccinated, that's when herd immunity kicks in. So if you're talking herd immunity without a vaccine, that's basically a nationwide eugenics program. And with the far right bent and the be frank, fascist bent of the GOP as of late, not surprising to me that they would be on board for something like that, especially the Trump administration. COVID is #1 killer of cops too. Whoa, really, Jay? That's fascinating. Yeah, so hey, I guess I don't know if you're gonna get through to the Blue Lives Matter crowd with that. You could try, but I'm not so sure that's gonna help. But yeah, man, COVID. I mean, this COVID is the story that has been unescapable, and it was, it was hard not to escape it all year and not to lead with it every time. Like I hit a point where it's like, is every one of my videos just going to be about COVID? Are all my stories going to be on my website, Political Pain, going to be about COVID? Because it's all consuming.